Cervical spondylosis, causes, symptoms, and comprehensive treatment approaches. Hi. Cervical spondylosis, a common bone and joint disorder that affects about 2/3 of the global population, is especially high risk for people of working age. This reason is often related to occupational factors, such as prolonged desk work and unhealthy lifestyle habits such as poor posture and lack of physical activity. Comprehending cervical spondylosis. Cervical spondylosis is a complex bone and joint disease characterized by gradual degeneration of the cervical spine. This degeneration begins with inflammation and calcium deposition around the vertebrae, leading to a narrowing of the vertebral spaces. As a result, natural blood flow and nerve function are hindered, leading to symptoms, which are especially noticeable during physical activity. Currently, the incidence of cervical spondylosis in men and women is the same. It presents as a slowly progressive chronic disease, capable of affecting any vertebrae, with the C5, C6, and C7 cervical vertebrae being the most affected. Treatment perspectives. Effective treatment requires not only professional intervention but also the patient's active participation and understanding of their medical condition. Early detection along with adherence to medical instructions will improve the prospects of a speedy recovery. Conversely, neglect or haphazard application of unproven methods will increase the risk of complications, potentially affecting overall health. Causes of cervical spondylosis. Cervical spine degeneration mainly comes from 5 factors such as aging, poor posture, bone spurs, disc dehydration, and ligament degeneration. Furthermore, modern lifestyle and genetic predisposition also contribute significantly to cervical spondylosis. Symptoms. Recognizing symptoms in the early stages is always difficult. However, in advanced stages, identifiable signs appear such as neck pain, arm numbness, morning stiffness, Lhermitte sign, and other symptoms such as dizziness. If left untreated, cervical spondylosis can lead to complications such as vestibular disorders, cervical disc herniation, and weakness or numbness in the lower neck area. Diagnosis. Clinical examination and imaging techniques like X-rays, CT scans, and MRI are commonly employed for the diagnosis of cervical spondylosis. Treatment approaches. Various therapies focus on symptom reduction and improving cervical spine mobility. These include rest and relaxation, hot and cold compresses, acupuncture, medication, physical therapy, and chiropractic therapy. Prevention. Preventing cervical spondylosis involves adopting ergonomic practices, maintaining a balanced lifestyle, regular exercise, and ensuring proper nutrition. In more severe cases, non-surgical orthopedic treatments can be considered before resorting to surgical intervention. So, a comprehensive approach combining rest, heat therapy, acupuncture, medications, physiotherapy, and chiropractic can effectively relieve pain in patients with cervical spondylosis. If you have a cervical spine problem, prioritize preventative measures and seek medical advice for a personalized treatment plan tailored to your specific health and condition. Wishing you good health. Thank you. Goodbye and see you.